the fear that it might pop out or fall out. Well, I have to tell you, it is true that your IUD can fall out. The overall risk of that happening is 1 out of 20 women. So that's quite common. And it's more likely to happen within the first year and around the first 3 months when you fitted it and during a period. The coil is also more likely to fall out if it's inserted immediately after childbirth. In teenagers, people with fibroids or who have heavy menstrual bleeding and other causes of a distorted womb, if you're using a menstrual product like the menstrual cup and if it's fallen out before. So it is important that you keep track of your threads by feeling them at least once a month after your menstrual period. Some women cannot tolerate having the coil because they're afraid it might perforate their womb or other organs and travel to other parts of the body. I can completely understand this fear, but how often does it actually happen? Well, the answer is not much. According to the Faculty of Sexual and Reproductive Healthcare, the FSRH, the rate of your coil perforating your womb and moving around the body is actually very low. So we're speaking in terms of numbers of around 1 or 2 women in every 1,000. Perforation is also something that is probably more common in women who've had their coil fitted soon after having their baby. Signs of perforation can include low abdominal or pelvic pain, being unable to feel your threads, or you notice a change to your bleeding pattern. Please seek urgent medical advice. The next reason that we're looking at today is the fear that having the IUD in place increases the risk of infections. Many women are pretty sure that it's because they have the IUD that they're getting more episodes of thrush or BV, that's bacterial vaginosis, in a way that never happened before they got the coil. Some of this fear might be valid, but we have to say that we don't see these infections in every woman who's using the coil. However, what about PID, that's pelvic inflammatory disease? We know that the risk of having a serious pelvic infection is highest within the first 3 weeks